All right, guys. Just a quick 10 minutes, exactly 10 minutes. We have 12 minutes actually. I have a call at 8 o'clock with a different group. So let us really get something out of this 10 minutes. And I'm going to give the floor to Pooja. Pooja will introduce herself, go through her journey, what she did with the marketing and how she landed this job. She actually had two offers in the same month. She took the first offer, started working. Now she's taking the best offer on a financial reason, and she's here. So Pooja, all yours.
Hi everyone.
Hello.
Hi. So
Hi, Pooja.
hi. Actually, I can't see it. Even so, I was just wondering.
You can't see? What do you mean you can't see?
Yeah, I cannot. I'll just rejoin 1 second.
No, don't do that. Oh, God.
Sorry, I had to re-log it. I don't know. I've said something wrong.
Now are you able to see our pretty faces?
Yeah, I'm able to see yours. Okay, so hi everyone. My name is Pooja Naidu, and I just recently got placed in one of the companies, and there were three offers. So I selected one, and as Abhishek stated, I moved to another offer. So, what questions do you have for me?
So tell me about your educational qualification. Tell me about your experience in PV.
Okay.
Tell me about your journey with MediPharm Solutions.
Sure.
And all those things.
Sure. So I have completed my MSc Masters in Biotechnology from India. And after that, I moved as a clinical research associate. I got a job in IQVIA. At that time, it was called as Quintiles. So I joined IQVIA and then as a clinical research associate. And after that, I did in some of the couple of companies as a clinical research associate job itself. And then since there's a lot of traveling, I moved to pharmacovigilance sector and worked with Accenture. And oh, thanks, Swapnil. And then later I moved to the US, and I have a real job experience of IQVIA earlier to this in the US. And uh, then what else, Abhishek? Yeah, and I have not done my training with MediPharm, but MediPharm has helped me to get a job. I have done only marketing with them. So it was like really a good journey. And do you have any questions?
So you got two offers last month, right?
Yes, I do. I did have two offers last month. Yeah.
So how was the interview process for each of them? Just take 2 minutes for each of them.
Okay.
Go through the interview process.
Interview process was pretty simple, as you all know. First was a call. Okay, so all the three offers were full-time offers and not contract. First of all, and so the interview process was with the HR first. I had 20 minutes to 30 minutes, 20 minutes approximate call with the HR, and post that I had a video call, video interview, which was technical interview. So generally they ask all the related questions to pharmacovigilance, and of course my experience and what did I do earlier to that. So that was a second round of interview, and that was it for the first job. For the second one, it was a big process. I had overall 5 interview rounds in that. So day one was like for the HR, two with the manager. It was technical round, and after that, I had a full day interview from morning 9 o'clock to around 2 o'clock. So
you're now shit scaring these people right now. That's okay.
No, that was also pretty good. So there are some technical questions which will ask, or there are general questions also, like how did I deal with the sites, and there were some questions based on my CRA experience, and some questions were based on pharmacovigilance experience. So that was it.
So basically what she's saying is, in a nutshell, the interview process is not the same from company to company.
Yes.
As long as you know your stuff and you were confident in presenting, you should be good.
Yeah.
Okay.
I have a question.
Sure, please.
Yeah, thank you very much, Pooja, for coming to share your experience. Real quick question. Do you think your experience as a CRA helped you to land this job?
My experience with CRA helped me not to land into this job, but definitely helps me with, continuing the job, because I know the clinical research, like, CRA experience with the CRA experience, what I have. So I have a knowledge of the other side of what happens at the site, and what happens at the site. So definitely it helps. But during the interview process, no, nothing related to CRA was asked to me. It was just pharmacovigilance more of.
Hi, Pooja.
All right, thank you.
Congratulations. Yeah, congratulations.
Thank you.
When you were sharing, you said you had pharmacovigilance experience from Accenture. What did you do there actually?
Same case processor.
Okay. So you had prior experience with drug safety.
Yes, I did.
Okay. Thank you.
That's the reason she escaped our training.
Hi, Pooja. Congratulations.
Thank you.
So what role, I have two questions. One is, what role did you land? And during your 5 sessions of interviews, did you get like repeated questions, or were they all different like every round?
Okay. So the first role was a PV officer, senior PV officer role. Yes, there were see, because we many, like I think 9 of them interviewed me. So generally everyone will ask you to start with what is your background, what did you do, and what experience you have. So first 10 to 12 minutes, they'll just ask about all those, and then they will introduce themselves, what the company does, those type of questions. And only after that they might ask you 1 or 2 questions which might be different from one interviewer to another interviewer. But basically first 15 minutes it will all be the same. You talk, they talk, and that's it.
Okay, thank you.
Hello, Pooja. Congratulations.
Hi.
Do you think most of the questions are from the job description?
Okay, yeah, that's a good question actually. So yes, it depends upon the company. For the first company which I had given an interview, it was more from the job description, yes. And also it was more Argus related questions which they asked me. And they did ask me in detail from tab to tab for the first one. For the second one, it was not much related to job description, but they did ask me a lot from my CV. So please be prepared with your CVs, and so that whatever they ask you from the CV, at least you need to answer. So if you have an experience of Argus, you say only Argus in your CV, not write Argus, even if you know it, Argus G. Just write whatever you actually know. So it'll help.
Thank you.
Hi, Pooja. Congratulations. I want to find out if we were given like practical scenarios, hands-on, or were they more like theoretical questions?
Oh, sorry, I didn't get the question. Can you please
So,
repeat? I'm sorry.
Yeah, I want to find out if you were given practical scenarios to respond to, or were they just theoretical questions, like were they practical applicable questions that you needed to answer?
Got your question. So mostly it will be theoretical questions. Also, it is based upon your experience. So if I have a experience around like 8 years of experience total, so they don't ask me like kind of what is this, what is that, and particular questions like what is an SAE and how do you report it. Of course, they know that I should be knowing that. So it depends upon how much of experience you put in your CV. So based upon that, they'll ask you the questions. Yes, uh, situational based questions were many questions. I could answer it. Few I answered with pharmacovigilance based, and few I could answer as a CRA based question. So depending upon the question and the real scenarios I faced, I did answer those questions. So it all depends upon your experience.
So
Thank you.
thank you, Pooja. And also, I wanted to thank Pooja for one other thing. Once she got an offer in the company that she's going to be working, or she's working now, she helped one of our students actually prepare for the same interview. She did not have to do it, but she did it. And this person, the person that you're going to talk to, or she's going to talk to you next week, Shipra, she actually got the job. I don't know if Pooja knows this. You know it?
Yeah, you told me that.
So she's not only in a job, but she was able to help another student get into the same company, the same role, the same thing, because the interviewers probably will have less questions the second time. And this happens a lot. Like Paraxel, we had 3 students, one after the other. And what is that? Clovis Pharma, the same thing. We had 1 student, we are now 2 students having interviews. So it becomes much easier when you kind of give, because Pooja doesn't have to be on this call, but she agreed to be because she has seen this kind of calls when she was preparing.
Yeah.
So that really helped us. So when I'm going to reach out to you, when you guys get the job, come on this call, turn on your video and just talk to people, because I can only do so much. And you guys can actually inspire a lot of people, because they will relate to you, because now they think that, oh, this guy knows something for 10 years, so they'll not be able to relate. But if you see someone just like yourself, it becomes much relatable. Am I making sense?
Yes.
Right. Cool. So Pooja,
Yeah,
one
it
last
is.
thing I wanted to ask you,
Mhm.
and this is almost like a photo shoot for you right